Anyway, I'm glad to see so many survivors here, and as you know, it's really a challenge just to get through the surgery and chemotherapy and all the other treatments, and it's such a trying period. And then you get to the end, and kind of all that adrenaline goes down, and you're left with, what now? And what do we have to do after that? And so there's so many things that happen, as you all can tell us, and please do talk to us as your doctors. We need to know what's going on with you so that we can help. But some of the things that repeatedly come up in surveys of ovarian cancer survivors, and I'll generalize a little bit to all GYN oncology survivors. First is body image. So there's so many things that change from all the surgery, from the chemotherapy, from the steroids, from the antiemetics, etc. It's a pretty major change. And then functional capacity and fatigue. We'll talk about each one of these a little bit more in just a moment. The menopausal state, sexual function, and then bodily functions. All of these changes you can tell us, right? So we'll talk a little bit about what to do. So from body image, the scars, some of you may have ostomies, may have had temporary ostomies. Some of these things are really major changes in the way you feel, the way you appear, and the way you interact with other people. The portacat scar is sometimes a little hard to hide, as it's frequently so high up. I hear a lot of women complain that they really want that somewhere other than such a visible spot, this constant reminder. And then lymphedema. The swelling in the lower extremities, both legs, as a result of the surgery from taking out lymph nodes, is very common. In reports, it's up to 70–80% of women who have had major surgery, lymphadenectomies included for ovarian cancer and other diseases, will develop swelling in the legs. And it's progressive over their lifetime, unfortunately. And it does have a major impact on their functional capacity, their ability to walk as the legs get heavier and heavier, and as you get older and feel more fatigued and tired. It's a major impact on quality of life and functional status. So functional capacity, we refer to it in our notes as performance status. And it's just a measure of how close you are to your normal everyday functioning life before you had ovarian cancer. And the one common theme in almost every survey is severe fatigue. And the fatigue does get better over time, but it takes a long time. And you all can tell us, right? It can take months, it can take years sometimes, and some of the surveys report that it's lifelong. Ability to perform your activities of daily living. This is everything from going to the bathroom on your own, to showering on your own, dressing on your own. And there are times where the fatigue can be so severe that you need assistance with all of that, or the other disabilities as a result of all your treatments. Be it neuropathy, be it the lymphedema, whatever it is that makes it difficult to bend over, put on your clothes, button buttons, etc. Exercise tolerance, this too is something that can be significantly impacted in a negative way. Again, it goes back to the fatigue, and it's very hard to get back to an exercise program, but it is critical to building your endurance back. So it's a catch-22. You have the fatigue, and yet you need to go out and exercise to try and get over that. And for those people that were runners or exercise regularly, whatever it was, tennis playing or whatever, this can be a little bit of a challenge to get back to what you perceive as your normal life. And it takes time. You have to be patient with yourself and gradually ease back into that. Working. There's actually now several surveys that show that the treatment from ovarian cancer can impact one's ability to work even for the rest of your life. The combination of neuropathy, the fatigue, other factors that make it difficult to get up, get around, carry on a full 8-hour workday, travel to and from, can be severely impacted. And the number of days that women miss also has increased significantly in patients that have undergone treatment for ovarian cancer. So these are things that we weren't going to expect. But also, again, talk to your doctors, see what we can do to help manage these problems before they become even bigger problems. And also just the fact that at times people lose their independence during the treatment. It can be so debilitating, or after the treatment, you just want your own autonomy back. You're independent. You want to live your life the way you're used to living your life. And that can be very hard to adjust for a while and give up that autonomy. And I see so many of my patients where the children come in and they're trying to get involved, and they're trying to tell their parents what to do, and the parents are going, I've taken care of you for so many years, stop telling me what to do, right? But at the same time, it may be time that you give up the caregiver role and accept a little caring of yourself. So it can be very difficult. Menopause. Vasomotor symptoms, otherwise known as hot flashes, vaginal dryness, osteoporosis, and changes in skin and hair can all go back to the body image issue, and also can affect everything from sleep to functioning during the day. There's a lot of controversy over how to treat these symptoms in cancer survivors, particularly ovarian and especially in breast cancer survivors. But I will just say, at least within my practice, hormones are not always contraindicated. You always have to weigh the risks and benefits. You also have to look at the other treatment options, and you just have to see what it takes to help women get back to their normal selves. Sexuality, again, from surveys, we hear repeatedly that women feel like they've lost their femininity because they lost their uterus, tubes, ovaries, menopause, as well as their ability to function sexually and engage in intimate relationships. And the loss of libido from hormonal changes can also be a challenge for many women, and also for the relationships. So it can be hard to talk about with your partner. It can be hard to find ways to adapt to a new relationship, or a new, I shouldn't say a new relationship, but changing your relationship to a different kind of relationship to maintain the intimacy and friendship with your partner. And just fear of sexual activity can also be a major issue. And I've had a number of my patients come back and say, I'm just afraid to do that, it may break something, it may cause the cancer to come back or something. And again, none of those things are true. Nothing's going to break. It's not going to make the cancer come back, but talk to your doctors. They'll be able to give you guidance. Other bodily functions, cognition and memory. This has been fairly well documented that anybody that undergoes chemotherapy has a consistent loss of particularly short-term memory, but memory in general. And also there are some measures that have demonstrated a slight decline in their ability to for critical thinking, basically. So that is impaired from all the chemotherapy drugs. It does take a little bit longer to adjust to. There are mental exercises that have been proposed and tried in a number of studies that can help minimize the impact or help recover some of the lost function. So there is hope there. The peripheral neuropathy. This too can be very difficult to treat. There are treatments available, mostly for the pain. We will never, well, we have not found any drugs that will ever get us back to normal sensation, a normal feeling in the hands or the feet. But there are a number of treatments we can use to minimize the pain and help with the functional status. Physical therapy can also help if the neuropathy in the feet is really severe. Gastrointestinal. Looking at recent surveys again at long-term survivors, most women with ovarian cancer, 70% or so, will incur some kind of change in their digestive system. They'll have intermittent bouts of indigestion, reflux, bloating, pain, etc. And this is all from the surgeries, the adhesions, the valve resections, etc. And so learning how to adapt your diet and minimize these symptoms it can be very important. Urinary incontinence is something that many women just attribute to being older and having children. But as it turns out, our treatments seem to increase the frequency and early onset of urinary and occasionally rectal incontinence as well. And so again, these are things that there may be treatments available depending upon the situation. So please talk about these things with your doctor. And there are a number of things that can be done in many circumstances. From an emotional standpoint and psychological, many patients get to a point where they finish all their treatments or planned treatments. They may be on maintenance therapy, they may not, but they still have anxiety. Is the cancer going to come back? What are we going to do about it? And trying to overcome that anxiety and help patients kind of settle down and refocus on trying to live their life, I think is really the most important aspect. I know ovarian cancer takes over your life, and it can be a long time before you kind of regain some control. But overcoming that anxiety and moving on and looking forward to life again is a big part of that. Depression, also very common in all cancer survivors. Stress and survivor guilt. Survivor guilt, again, once you get through all that, how did I survive? Why did I, or not the other people I saw in the infusion center or elsewhere, can also be somewhat debilitating. We talked a little bit about relationships, as they all will change. Instead of you being the caregiver, you being the giver overall, you may not be able to give in the same capacity or to the same extent. So learning how to re-navigate or renegotiate those relationships and what you can do and what you can't do can be another challenge in your life, and it takes time. And you need to find the people that are really close to you and rebuild those relationships and make sure that they work. I've already talked a little bit about employment and how ovarian cancer treatments can impact that. Finance, I think certainly all our survivors know how that can impact your financial situation and insurance status. And the health of your social unit is really important. So get those people close to you. Make sure you rebuild those relationships. Make sure people know what you can and can't do. Make sure you have open communication with all the people that are around you that want to support you, and make sure you engage with all of them. So, common questions. Will the cancer come back? We'll need to talk to your doctor. Everybody's a little bit different. The circumstances are different. Yes, ovarian cancer does have a high rate of recurrence, and it can happen at different times. And so your doctor, knowing your treatment, how much cancer was there at the beginning, how much was after surgery, how you responded to treatments, etc., can give you some insight as to what to expect. But again, try to get past that and start, when you have a chance, regain control and live your life. How will I know if the cancer has returned? It's pretty much all the same symptoms that were there when we were diagnosed. What is the risk of cancer to my family? We'll talk about that in just a minute. Struggle with one's own mortality, and what can I do to reduce my risk of cancer returning? So the Survivor's Care Plan is something that was a hot topic maybe 5 or 6 years ago, and I have to turn to my colleagues and ask them, do you all routinely use survivor care plans to give your patients or your referring doctors? Yes? We kind of do. And in fact, what has happened is that the more recent literature is suggesting that these are as likely to cause anxiety to the patient as they are to help the patient. And so I think it's best to ask the patients what you want, how much information you want or need. Because these care plans sometimes can be so brief they're not really informative, and on other occasions can be 20, 30 pages long, but they include every potential complication. And patients can just get overwhelmed and say, I'm going to get these things, etc. So finding the balance, finding what each individual wants to know, what they don't want to know, I think is important. These are all the various components. At the end, I mentioned they can sometimes not be very concise and they can cause anxiety. So knowing what you want to know will help us provide that information in a way that's understandable and digestible. So what is the risk to my family? Well, we need to know your family history pretty well, and this is a fairly detailed approach, but nowadays genetic testing is getting so inexpensive and so readily available that I think we're bypassing a lot of the detailed pedigrees that we used to require. We still need to know some information in order for insurance companies to cover the genetic component, but not everybody is genetically predisposed or has a risk of passing this risk on to their children. But knowing your family history, talking to people, keeping us updated as other people in the family may be diagnosed with ovarian cancer or other types of cancers will help us better determine whether or not you need genetic testing. Those patients that have endometrial or colon cancer usually get screened as part of the diagnosis and treatment. It's just a partial screen on the pathology report. So you may have some useful information if anybody in the family has either endometrial or colon cancer. The other cancers, not so much. Struggle with one's own mortality. I think as all of us age, we start struggling a little bit with this, but it's not quite as real as those that undergo true life-threatening illnesses. And the data for virtually any type of cancer is the same as those undergoing a heart attack or stroke or other things. So the question is, how do you get back to your normal state and take control of your life and have your own autonomy and figure out what it is you want out of life. Family members don't want to make decisions for you about what would happen if you did have an acute event, such as a stroke or a heart attack. It's usually best if you talk to your family members, you make those decisions yourself, you inform your doctors whether you want us to do everything to try and revive you or what things you want, and under what circumstances. And having all this written down is very important. So end-of-life issues, the family needs to understand what your wishes are. And these things should be discussed when you're in good health, in a good frame of mind, and can have a good conversation with the family without it being laden with too many other emotions that you're going through at the same time. That may be hard to find that time, but it's usually very, very good to be able to have that conversation with them. So consider a will and testament, make sure that you get all your finances in order, advance directives of the living will, and the code status for all components of that. What can I do to reduce my risk? I've read a number of different books that my patients have told me about over the years, and this is still my favorite, Anti-Cancer. I don't know if anybody in here has seen it or read it, but the author, Dr. Scribner, I believe, he was a neurologist who was conducting research on, and he decided to be a subject in his own clinical trial and had an MRI of his brain and found a brain tumor at the age of 30. He survived 20 years, which is a lot longer than expected. I think he had 2 recurrences during those 20 years. And it was through all his own research and adaptation from everything from diet to exercise to supplements, etc., that he gathered the data like a true scientist, analyzed it, and presents this in a very acceptable, very easy read that can help you with a lot of different aspects of your life. And there are a lot of other books out there about survivorship, and specifically about survivorship for ovarian cancer. I've read several of them. It's sort of like the internet. Everybody likes to tell their bad stories. Everybody likes to tell their good stories. So be careful. And this one, again, it doesn't focus entirely on good stories. It kind of tells everything. But it definitely gives you a path forward that you can use to incorporate in your life and take control of your life and do something to alter your future. Another thing that you can do, Foundation for Women's Cancer, this is heavily supported by the Society of Gynecologic Oncologists, which almost every gynecologic oncologist you meet will be part of that society. And they do have a page for survivorship. And so the next 3 slides. So they have information here, everything including a survivorship plan. And they also have recommendations for things to do as well. And I certainly can't go through the whole web page. It's there, it's available, it's free, it's easily accessed. It's a good source of knowledge where it's been well vetted by a number of different physicians that treat patients with ovarian cancer all the time. So they also, at the end, have several other well vetted web pages that you can go to that would provide additional information. So it's foundationforwomenscancer.org is the web page. So in summary, care plans can be a good reference, but again, help us tailor it to your needs. Don't let us overwhelm you or give you too much stress. Discuss your health and your wishes with your family and your doctors. Assume responsibility for the things that you can control. Take control of your life again. Take control of your happiness or what you wish to achieve in your life. Actively participate in your care and discuss your family history, cancer family history with your doctor and genetic counselors to determine the rest of the family's risk. And I think that's it. Thank you for your time.